There are a number of challenges that we face when it comes to trying to roll out COVID-19 vaccines, but an important component, especially in the immediate future, as to how well Africa will perform in the rollout of COVID-19 vaccines really depends on philanthropists coming to the fore to ensure that there's adequate procurement of vaccines in a timely manner so that it can be rolled out, especially in those African countries that simply aren't able to compete on a market in range through bilateral agreements.
What should we be learning from this is, it reminds us that in order for us to be able to perform better in the next pandemic, since we're being told that it's when and not if it happens, we need to rehearse. We need to make sure that we have systems in place that can actually get activated, vetted systems that have been proven to scale, as opposed to trying out new methods. Nobody really intended on Serum Institute not being able to meet the global demand because it was overwhelmed by the country demand. But it tells us that, if we continue not to really take this seriously and not rehearse for it, we will be caught in the same scenario in the next pandemic.
These vaccines arrived with a short expiry. Countries were not yet ready. There were no operational funds. In most countries, health workers were not yet trained. Community mobilization had not yet been done. And this has ended up giving us a bad name because these vaccines expired after they arrived with a 3-week shelf life that they still had.
And some of these sort of uncertainties about high self-financing and low-income countries, with all being under the same umbrella, I think need to be sorted out. And I personally would say that the focus should be on making sure that the poorest countries have access. I think that would be a clearer ask and would be clearer for philanthropic organizations.